I think it's officially the afternoon, and I'm very happy to see such a large group. Obviously, this is a topic of interest. I want to briefly introduce myself. My name is Dolores Brown. I'm a recently retired Foreign Service officer. I joined AFSA recently as the retirement benefits counselor, so I'm very happy to have that job, to be associated with AFSA, and I look forward to meeting all of you and hopefully being of some assistance. But I'm here today to introduce Paula Jakub. Welcome her back to AFSA. Paula is the Chief Executive Officer of the American Foreign Service Protective Association. She's been there for 30 years. This association administers the Foreign Service Benefit Plan, and Paula provides strategic leadership and enhances that insurance for its subscribers. She has a significant amount of experience in insurance, the field of insurance, over 40 years. She's formally recognized as one of the subject matter experts in the field. She is an FSI adjunct faculty member. So we're very lucky to have someone with her level of expertise to come to share her wisdom with us. Paula is also the executive director of the Senior Living Foundation of the American Foreign Service. Probably many of you are familiar with the Senior Living Foundation. It is the prime objective of this organization is to take care of elderly Foreign Service retirees and their spouses. It's a charitable organization, and there's actually information on the back table about it. And Ms. Jakub brings to that her proactive nature in really taking care of our colleagues. So what we're here to talk about today is how to coordinate your health benefits with Medicare. It's a topic that I think has its mysteries and complexities. And whether you subscribe to the Foreign Service Benefit Plan or another federal health benefit plan, what Ms. Jakub will be able to tell you about it will help you to unravel this topic. Her presentation, I understand, is about 45 minutes long, so you will have time to ask questions afterwards. Ms. Jakub does ask that we hold our questions during the presentation so she can run through it. This presentation also will be recorded and will be on the AFSA website. I get, I've only been here for about 2 weeks. I get a lot of questions about where do I find information. There's a wealth of information if you dig through the AFSA.org website. Practically it doesn't go back for 20 years, but for instance, there's a May presentation on long-term health care that is posted on the site. There's a wealth of information there, and Ms. Jakub's presentation that she does today will also be posted there, as well as the slides that she will use in the presentation. So with no further ado, I'd like you to welcome with me Paula Jakub.
Thank you. Okay, there it is. I was looking for this. Good afternoon, everybody. Thank you for being here. I appreciate all these people coming in to hear about the riveting and exciting information on Medicare and the Federal Employees Health Benefits Program. Regardless of what plan you have, I hope this information will help you in understanding what is the maze of the two programs. So this is actually for your information. It really does not apply to any of your private sector friends or families or colleagues. It's not for your neighbor who works, may have retired from General Motors or whatever. It's not for your cat or dog. It's just for you, okay? So the big question really is Part B. I mean, what do we do about Medicare Part B? Let me have a show of hands. How many of you are still actively employed under age 65? Oh my, okay, quite a few of you. All right, so no wonder you're here. This may be your first introduction. Welcome to my world. Okay, so some of the acronyms that I'm going to use during this presentation is when I talk about the FEHB, it's the Federal Employees Health Benefits Program. It is the umbrella program, and there are 262 different plans under that Federal Employees Health Benefits Program. When you see FFS, that is fee-for-service plans. Those are the traditional types of plans. You have Blue Cross, Foreign Service, APWU, GEHA. Those are the fee-for-service plans that are pretty much national and international. HMO is health maintenance organizations. These are the more restrictive in a local geographic area with specific providers and things and pharmacies that you can use. OOP, when you see that, that's meant out of your, it's out of pocket, that's out of your pocket, not our pocket. And of course, everybody knows OPM, what OPM stands for, the Office of Personnel Management. And so they are the overseer of the umbrella organization, the FEHB program. So Medicare, first off, Medicare, as many of you may know, Medicare does not cover anything while for overseas medical treatment. So why is this important? It's important because, especially in the Part B environment, if you're living overseas for a lot of your time, going to be traveling overseas, you know that the decision about Medicare Part B is a more complicated one then, right? Because you're not going to get the benefits for overseas when you're overseas. So we'll dig a little deeper into that. But it's actually right there on page 6 of your passport. Medicare doesn't cover people for services overseas. Of course, Medicare Part B may be a very good choice for you if you're going to live here, or retire here, live here, travel here, whatever. No matter what, Medicare Part A is always a good choice. So for most of the retirees here. So that is almost a no-brainer, but we'll get into that as well. Here's what I'm going to talk about in our 45 minutes to hour that we're together. I'm going to go over all 4 parts of Medicare. I'm going to go over the premium costs, how much it costs out of your premium. I'm going to your out-of-pocket costs as well. The provider types, all of the different provider types that work within the Medicare program, how your coverage works with the Medicare program, and what happens if you decide not to take Medicare Part B. And we're going to cover that in 45 minutes, so let's buckle up. Okay, Medicare has 4 parts. Medicare Part A is one of the original Medicares. It is the hospital Medicare. It's free in most cases, so you might as well take it. Medicare Part B is another part of the original Medicare. This is for medical services. There is a premium attached to that. It is the base premium for 2018 is $134 a month. And that is also subject to what they call means testing. When they developed the Medicare Modernization Act, they decided that people with higher incomes should pay higher Medicare Part B premium. So that is called means testing, and I'll explain that in a little more detail in a few minutes. Medicare Part C is the more comprehensive part of Medicare. It works more like an HMO, so you may get more services that will include your Part B premium, and there'll be other additional premiums attached to that, what you may know as Medicare Advantage plans. But those are the Medicare Part C plans. And Medicare Part D is the newest member of the Medicare family. This is where you find the drug benefit. Okay? So let's go over Medicare Part A. This is the hospital insurance. Now, this hospital insurance covers inpatient hospital care. Notice I'm bolded inpatient. It does not cover observation care. So, who knows what observation care is? Well, I'm going to tell you what observation care is. How's that? All right, so observation care is you get sick in the middle of the night, right? And you're in so much pain you have to go to the emergency room. They're not sure quite what's wrong with you, so they hook you up to an IV, run some tests, maybe even put you in a hospital room, right? You think you're inpatient. You're not. You're under what they call observation care. Now, that observation care can last anywhere from a few hours to, believe it or not, a few days. But it is not inpatient care. So if you do not have Medicare Part B, you may have somebody come up to you, one of their administrators, because you know they really want to know how you're going to pay for this. You may have them come up and say, all right, so you don't have Medicare Part B, this confinement isn't covered. Well, if you're not really sick, that's going to make you sick. So what, but you're fed and you have one of the FEHB plans, right? You're covered under that. FEHB plans pay for observation care under their medical benefit, so you're good. So you can concentrate on getting better. Okay. Medicare Part A is where you'll find hospice care services as well as very limited skilled nursing facility services. But back to this observation care, it's really important to understand that the stakes are even higher than being surprised that Medicare doesn't pay for observation care under Part A. If you have to go into a nursing home, the nursing home requirements under Medicare Part A are these. You must be discharged from an inpatient hospital stay, a 3-day inpatient hospital stay, immediately discharged to a Medicare-approved skilled nursing facility, and receive skilled care. But if you're under observation care, you have not met that criteria of being an inpatient hospital stay. So you can, and so therefore, Medicare doesn't pay anything towards your nursing home or your rehab. So the stakes are pretty high. What can we do about it? Not a whole lot, because if the hospital deems it observation care, that's how they're going to send it to the insurance company, and that's how they have to pay it. But just so you know that the stakes are really high. So you need to understand the difference between inpatient care and hospital care. I'll be happy to take questions afterwards. Here's some quick facts about Medicare Part A. Everyone eligible for premium-free Medicare Part A should enroll. Now, that is at age 65, whether you're working or not. It doesn't matter. If you do not enroll then when you get your Social Security benefits, whether it's 66 and a half or age 67 or whenever you're, or 70, whenever you decide to take your Social Security benefits, the administration will automatically enroll you in Medicare Part A and B if you're not already enrolled. Not a problem with Medicare A because you should already be enrolled. Problem with Medicare B if you don't want Medicare B. So if that happens to you, then you need to contact Social Security and say, I don't want Medicare Part B, and they will have to send you another card. If you do not do that, then then they will start taking that Medicare Part B premium out of your Social Security checks. So that's why it's so important. If you don't need Medicare Part B, don't want Medicare Part B, you're going to have to notify them and send the card back so that they can get you a corrected card. Medicare Part B, this is the second part of the Medicare program. It covers the medical services. It covers the provider visits, the tests, all of those labs and x-rays, things like that. It covers outpatient hospital services, including observation care. So if you have Medicare Part B, this is where it will cover you under observation care. This is where you'll find your durable medical equipment, hospital beds, things like that. Kidney dialysis is part of the Medicare Part B program. That's where that's covered. And certain preventive and diagnostic and screening tests are covered under Medicare Part B. Now, here's what's not covered under Medicare Part B. While they will cover a yearly wellness visit, Medicare Part B does not cover an annual physical examination. That comes as a big surprise to people. So who covers your Medicare, your annual physical? The FEHB does. See, it's great to be a Fed, right? Your FEHB will cover it and cover it with their normal benefits. So if you go to an in-network physician for your physical exam, It's covered at 100% under any of the FEHB plans. Doesn't matter what plan you have. It's covered at 100%. But don't turn to Medicare. Don't expect Medicare to pay for that. Okay, quick facts about Medicare Part B. Enrollment in Medicare Part B is voluntary at age 65. First opportunity is at age 65, and it is voluntary. There is a premium attached to it. I have to ask, do I have anybody here who is TRICARE? Okay, so for you, for TRICARE people, TRICARE, in order for you to get TRICARE for life, Medicare Part A and B is not voluntary, it's mandatory. That is a TRICARE rule, it is not an FEHB rule. Okay, you may have to pay a penalty for your Medicare Part B plan if you do not enroll at your first opportunity to enroll, which is at age 65. But you can also defer that decision under certain circumstances. If you are working after age 65 and you have your health insurance as an active employee, your current health insurance is because of it's a benefit of your current employment, then you can actually defer that Medicare Part B decision. You are not required to take Medicare Part B if you are an active employee and you receive your health insurance based on that active employment. Okay, that is for your current employment, not as a retiree. So it gets a little tricky here. Many of you will retire at age 65, and then you will go off to other jobs, right? But your insurance is as a retiree then. So do not assume that you can defer that decision. And I'll tell you when you need to make that Medicare decision in just a minute. But the key here is you are getting your health insurance based on your active employment, not as a retiree. Okay, remember I said there was a premium attached to Medicare Part B? And this is probably one of the only reasons you guys came to see me. We're going to go through this chart a little bit. Medicare has decided that the Medicare Part B premium will be based on your level of income. And the income is based on your modified adjusted gross income on your 1040, your tax statement. Now, I put several more lines here because last year, a couple of years ago, there was this issue with there was no COLA or there was minimal COLA, so people who had Medicare Part B and had Social Security were held harmless, and the rest of us who may have been under the old system were not held harmless. So there was this big deal about the people who were held harmless didn't get the increase in Medicare Part B premium, but the rest of us did because we weren't under the Social Security program. That has been leveled out, as it usually does. This is about the third time in the last 10 years that phenomenon has happened. But for the people who were held harmless, meaning they got their Medicare Part B from their Social Security benefits, okay, for those people whose increase, COLA increase, covered the increase in Medicare Part B, they went up to $134, which is the base. For those people whose COLA did not meet that, they were held to a lesser amount. But for the rest of us, the standard Medicare Part B premium is $134. If your modified adjusted gross income for an individual tax is $85,000 and for joint is $170,000 and below. This is not based on last year's tax statement. They go back every year. Every person who takes Medicare Part B, they do this. They go back and look at your 1040 statement from 2 years ago, which means that your 2018 premium was based on your modified adjusted gross income in 2016. And if it was, you can see how it gets really pricey, especially for those of you who are really smart and you've got investments and all this stuff. It can be as much as over $400 a month per person. So you can see where there's a problem, or at least a challenge in deciding whether to take Medicare Part B. And we'll get into more detail about that too, but I wanted to show you the chart. I kind of like charts. Now, Medicare Part C is the comprehensive plan. This works like an HMO, like I said. This is a way to receive your Medicare benefits from private sector plans. AARP has one. I mean, you have those private sector companies that have offered these Medicare Advantage plans to people. You receive your Medicare Part A and B benefits, and you also receive some others because it's an HMO. So there may be a little more comprehensive, but the rules are different. It's not straight out you go to a doctor and they pay their 80%. They're a little bit different. Now, this is not really popular with the federal retiree. These plans are hugely popular with private sector retirees. Why is that? Because they have nowhere else to go. But you're a Fed. You get to keep your health plans, right? And the government continues to pay its share of the premium. Great to be a Fed. That's why not that popular. But if a federal retiree would decide that they want to try a Medicare Advantage plan, this is one of the very few times that you can actually suspend your FEHB coverage, not cancel. What happens if you cancel your FEHB coverage? You can't get it back. But you're not canceling it, you're suspending it. So for the foreign service retirees, you would go through Charleston. For the civil service retirees in the room, you would go through OPM and suspend that coverage. So at a later date, next open season, whatever, you decide, well, this didn't work out for me. I want to go back to what I had before. You can do that. No harm, no foul. So it's pretty flexible. Medicare Part D, this is the prescription drug benefit coverage. There is a premium attached to this as well. And it also has a means testing, which means if it is subject to the modified adjusted gross income line as well. The cost varies by plan. There's probably 100 different plans under the Medicare Part D program in this geographic area. So it's really difficult to decipher and try to go through that maze. There is a late enrollment for people who didn't enroll when they first could have, unless they have creditable coverage. Now, lucky for a Fed, every single federal health plan, all 262 of us, are considered creditable coverage, which means that your prescription benefits in your federal health plan are at least as good, if not better, than the standard Medicare Part D plan that is offered. Why is that important to the Fed? Because on page 2, the inside cover of any of your federal health plans, it states from OPM, you have a nice little letter from OPM that states the federal retiree will likely not benefit from purchasing a Medicare Part D plan because you have great prescription drug benefits in your health plan that you're already paying for. Great to be a Fed, right? Now, there are some exceptions. There's already some exceptions. There may be some federal subsidies for low income, whatever, which really does help, mostly in private sector. But for the federal retiree, I don't see a lot of people taking Medicare Part D because they have the Feds. Whether it's Foreign Service, Blue Cross, whatever you have, it's great. Great to be a Fed. Okay. When do you sign up? Now, many of you have already signed up, so this may be a little repetitive. For those of you who haven't signed up yet, here's where you sign up. Your initial enrollment period is the 7-month period around your 65th birthday. Happy birthday. 3 months prior, the month of your birthday, and 3 months afterwards. All right, that is your initial enrollment period where you sign up for Medicare Part A. regardless of your working status, right? And you think about signing up for Medicare Part B. If you are still working and you don't want Medicare Part B, that's okay. You don't have to have it then. Or if you decide, if you're still working, you don't have to take it. You can look at it at a special enrollment period. Now that is defined as an 8-month period after you retire and you lose your health insurance as an active employee, and you switch from active to retiree. So you retired at age 65, you have your initial enrollment period. If you decide not to, you retired at age 67 or 68 or whatever for our civil service colleagues. You don't have to get the Medicare Part B decision until then, and you have 8 months to decide. Now, you have to have certain paperwork, though, because Medicare is going to say, well, you're too late, you're going to get a penalty unless you have these forms. Okay, they're the 40B application, and then there's the L564 proof of current employment that has to be signed by your employer. So when you're doing your paperwork for retirement, this is one of the forms you need from retirement, is to make sure that they give you that form so that you can prove that even though I'm 67, I have had that insurance as an active employee. And there's also the general enrollment period, not to be combined with the regular enrollment period that is October. You hear all of the Medicare Advantage plans and come to my prescription drug benefit plan, we're the best around. That's different. That is for people who already have it and you want to change. This general enrollment period is for people who decide at age 68 or wherever that they maybe want Medicare Part B. So they want to enroll, and you can get into it January through March is the general enrollment period, and that will take effect in July of that year. Okay? No fuss, no muss, except you're subject to then the late enrollment penalty for Part B. And this is kind of hefty. And here's how that works. For every 12-month period that you did not have Medicare Part B and you could have had Medicare Part B, Medicare will penalize you and increase your premium by 10% for each 12-month period that will last you for the rest of your life. Got your attention on that one. This is not a one and done. All right? This will last you for the rest of, so say you're 68, you decided not to take Medicare Part B at 65. You've got 36 months, right? 3 years. Just work with me here. 3 years, right? That's 36 months. So that, just say that you are below the income. So it's $134, right? Plus 30% forever. So they mean business. That's why this decision is so important, to make the right decision for you at the right time. So, you know, it's pretty pricey. So, down at the bottom here, I say notify your FEHB plan. No matter what you decide at age 65, whether you're going to take A or not take B, please notify your FEHB plan. If you decide at 67 to take Part B, please notify your FEHB plan, because we must hold your claims until we find out who pays primary. If you've got Medicare Part B, they pay primary, right? So we will hold your claims. So I could make a joke, but I don't think I want to do that right now. Okay, Medicare Part A. Remember when I said Medicare Part A was free? I lied. All right, here are your out-of-pocket costs. Those is out of your pocket, not our pocket. For the person who has Medicare Part A and goes into the hospital, the deductible for 2018 is $1,340. If you are sick enough to be in the hospital beyond the first 60 days, on the 61st day, you will be charged a daily copay of $335 a day. If you're really ill and you're in there for over 90 days, that hops to $670 a day. Lucky for you, you're fed, because guess what? Your health plan covers all that. You guys in the back can breathe. You're good. All right. Not so much with skilled nursing facility. So unlike the regular inpatient hospital deductibles and copays that I just talked about, skilled nursing facility benefits in the FEHB program work a little differently. Now, some of the plans have absolutely no skilled nursing facility benefits. The maximum that any of the plans have is maybe 90 days. Now, you must be skilled care in a skilled nursing facility. Can't be intermediate, can't be custodial care, has to be skilled. And the plans will coordinate benefits with Medicare. So, and that's from day one. So do not assume that because you have the FEHB program, which is an excellent program, that you are covered for skilled nursing home. You are not. And if you are, it is very minimal. Thus, long-term care insurance. All right, Part B isn't quite as bad. Medicare Part B deductible for 2018 is sitting at $183 right now. Don't be surprised if it increases in 2019. It usually does, but for now it's $183. And then you're also expected to pay a 20% coinsurance, which is Medicare pays 80% of the charge and you pay 20% of the charge. That's great, right? If you go to a non-participating physician, you may be expected to pay extra for that. And I'll get into detail in a little bit. So while we're looking at physicians, let's talk about the different types of physicians. Now, we all know there's hundreds of different types of physicians, right? In the Medicare program, there's only 3. Here they are. Under the Medicare program, there is providers that are participating and they accept Medicare assignment. And that's very important. 2 words, accept assignment. These doctors we like. They play nice in the sandbox. And here's what they do. They agree to treat you. They agree to bill Medicare for the services. And they also agree to accept what Medicare says is the approved amount. Medicare pays 80%. Your health plan pays 20%. So you're golden, right? So we like these doctors because they take really good care of you. And your FEHB plan will cover the cost sharing. They'll cover the deductible of Medicare, and they'll cover that 20%. So these are good guys. Second type of physician are doctors who do not accept Medicare assignment. They are called non-participating physicians, but they actually kind of do participate in Medicare. I don't know why they use that name. These doctors can charge more than the Medicare approved amount, but there's a limit to what they can charge. Thus the name, the limiting charge. Very creative. Okay, about 15% more. Now, your health plans are only required to pay that regular cost sharing, that 20%. Some of the health plans stick by that rule, and some of the health plans will pay that extra 15% for you. You'll need to check with your health plan to find out. You may very well be responsible for that 15%. I have a chart. Provider who accepts assignment, provider who does not accept assignment. $1,000 charge. In the first scenario, Medicare approves $800 of that. They pay 80%, which is $640, and your health plan will pick up that extra $160. So your liability is nothing, which is great. Medicare, the doctor who does not accept Medicare assignment is known as a non-participating physician. Same charge. The Medicare limiting amount is $920. Medicare will only pay their $640. Your health plan is only required to pay its 20%, which is $160. You may be liable for $120. Not good or bad. You just need to understand when you go into the doctor's office what your risk is, what you can expect to pay out of your pocket. So, your two questions to that doctor's office when you make the appointment. First question, do you take Medicare? Many of them, most of them will say, oh yeah, we do. Next question, do you accept Medicare assignment? Write it down, you'll thank me someday. Okay. If they say, well, no, we're non-participating, we go by the limiting charge, that tells you that depending on your health plan, you may be liable for that extra money. Doctor may be the doctor you want to go to. Like I said, it's not good or bad. You just need to know how to play the game. These are the doctors we don't like so much. They don't play nice in the sandbox. These are the private contract opt-out doctors. Now, they will ask you to sign a written agreement with them saying you understand that they do not participate in Medicare at all and you are responsible for 100% of their charges. And that's all well and good. That means that you're going to pay all of them. But you can submit your claim to your federal health plan. And you think, I'm a Fed, I'm okay. Not so quick, not so fast. You're not okay. These are for you who have Medicare Part B. Is it moving? Okay, good. I thought, I haven't even drunk anything yet, and this thing is moving. Oh my goodness, don't record that. Here's what will happen when you file with your federal health plan. Because you have Medicare Part B and you made the choice to go to a physician who does not take Medicare, your health plan can only pay what we would have paid had you gone to a Medicare doctor, about 20%. That's it. Can't pay any more. I have a chart. Same thing, next column. These are the private contract doctors, the opt-out doctors. Same charge, $100. We run through what we call Medicare pricing, so we know what Medicare would approve. Medicare doesn't pay anything because you've gone to this doctor who has no contract with Medicare. Your FEHB plan will only pay that $160. You might, in this scenario, you might very well be liable for that $840. Now again, your choice, not good or bad, but you need to understand the risk of going to an opt-out physician. And if you have both the FEHB and Medicare Part B, it can get pricey, especially if you go to that doctor a lot. Okay, so in summary, in this part, if you have one of the FEHB fee-for-service plans, Blue Cross, Foreign Service, GHA, APWU, any of those, and you have Medicare Part A and B, you can look to the FEHB plan as an inexpensive kind of Medigap policy because we coordinate with Medicare. We pick up those deductibles and coinsurance, and then we waive our deductible and coinsurance, which makes your coverage, depending on what physician you go to, virtually 100%. All right, if you go to a Medicare participating provider. So you generally have little or no liability with all the coverages, and your FEHB plan remains primary on your drugs, on the normal drugs we take. All right, now some drugs, like some cancer drugs and some immunosuppressive drugs, that's a hard word to pronounce. Things like that, that falls under Medicare Part B, so we do coordinate. But most of the drugs that we take, the blood pressure, the heart, all of that, you would file with your health plan. So it's really a good deal. How many of you, changing gears, how many of you have one of the FEHB HMOs? Kaiser, United Healthcare, Care First. Any of you have an HMO, or you are all fee-for-service folks? Okay, well, for the audience in the recording, I do want to just go ahead and talk just a little bit about this. For those people who have an FEHB HMO, you may not need Medicare Part B. And here's why. You may not get any benefit from it because you can't claim those copays from Medicare Part B. And that's what you're paying for, right? So why would you get Medicare Part B? Well, I can think of a couple reasons. If you are in an HMO and there's a specialist you want to go to that's outside of that HMO, if you have Medicare Part B, they would cover that at 80%, right? So that may be one. If you decide you have an HMO here, but you travel, maybe you want to spend 3 months of the winter in Arizona visiting your grandchildren, you have a doctor there to treat your chronic condition, not covered under your HMO here, right? But if you have Medicare Part B, you can claim it. So, of course, there's always exceptions, but for the most part, people with a fee-for-service, an HMO under the FEHB program usually won't benefit from Medicare Part B. Now, in spite of the fact that there are hundreds of HMOs in the FEHB program, 70% of us choose one of the fee-for-service plans. So there's not too many people out there, but I do have to tell you the rules on that. Okay, let's change gears again. You feel like you're getting whiplash? Now, we've covered how Medicare and the FEHB program work very well together. All right, we've covered the rules about the different providers and the different out-of-pocket costs that you don't have to pay for because you have the FEHB plan. But let's now shift gears and talk about what happens when you decide not to take Medicare Part B. How many of you have already made that decision, do not have Medicare Part B? All right. So that's for you. For those of you who are thinking about it, this is what happens. What if you do not enroll in Medicare Part B? Absolutely nothing. Here's why. You are a Fed. You get to take your health insurance with you into retirement, right? You get the same benefits at the same premium because your employer, the federal government, pays their portion of the premium, continues that. So you get the same excellent benefits you had as an active duty person, but there isn't a coordination of benefits. So you're going to have out-of-pocket costs. Do you have out-of-pocket costs now? Yep. Nothing changes, right? You're going to pay the deductible, you're going to pay the co-payments, you're going to pay the co-insurance. Nothing changes. And a federal law that I'll get into limits your liability to some extent. And I'll go through this because this is really cool. By law, your FEHB plan cannot pay out more than they would have had you had Medicare. That doesn't sound too good, right? Except the second part. By law, the hospital or the provider cannot charge you more than they would have had you had Medicare. It's part of the FEHB Act. It's a very, very nice law. All right? So all Medicare participating and non-participating providers can only charge the Medicare approved amount or the actual charge if it's lower than the Medicare approved amount. I'm not even going to go there. So because of this law, and thank you, who is the gentleman who corrected me? I checked it. They did change it. Thank you very much. So I wanted to acknowledge. I know when I'm wrong. Okay? This law is now the 890.905 law, and I just looked it up, okay? And it says that your liability is limited. Now, remember I talked about those private contract doctors. And many of them will say, I don't care if you do or don't have Medicare, you have to sign this form that says I understand that I'm liable. If you sign that form, you've signed that you understand you're going to pay the full amount. So we can't help you there. But we can help you under normal circumstances because of this CFR law under Title V. Your explanation of benefits, regardless of whether you have the Foreign Service or Blue Cross or whatever, your explanation of benefits for those of you who do not have Medicare Part B will say your liability is limited to X because of this law. It will say that. So if the doctor tries to charge you, you say, hey, wait a minute, I want my money back because you can't charge me more. Now, most of the doctors here in this area, they know that. Maybe the doctors in Wyoming or Alaska, not so much. So if you have trouble, just call your health plan. Trust me, we know how to deal with them. All right? Call your health plan for further assistance. That's what I'm supposed to say. Sometimes I don't follow the rules. All right. So this is the newest update. So for those of you who are now bored to death because you've already heard this presentation a couple of times, this is new. This is why you came. Okay. We have fought with OPM for several years about these opt-out physicians, right? OPM finally came down with a ruling last October about these opt-out physicians, and it was not in our favor, it was in their favor. If the doctor, this law only applies to those first two physician types, the ones who accept assignments and the ones who do not, the Medicare participating and non-participating. This law does not affect those opt-out physicians. What does that mean for you? That means that those physicians can charge whatever they want to charge. However, remember I said nothing changes? This is a good example of that. Just because these doctors do not participate in Medicare does not mean they don't participate with your network, whether it's Blue Cross's network, Cigna, Aetna, whatever. Most of them are fine participating with the company's network. They just don't like Medicare for several reasons. So you are still protected by the negotiations that your health plan have in place with these physicians. So you're, to a certain extent, you're still protected because those discounts still apply. We all work things a little differently. I would recommend, of course, you always go to Section 9 in your health plans brochure, doesn't matter what plan you have, and look at the details about how your plan handles this. They're all uniform. It's called standard plain English. So you'll find it all there. Okay, so I want to point this out. How many of you have Medicare, have Blue Cross Blue Shield Basic? I won't take it personally. I just want to know. How many of those of you who have Blue Cross Blue Shield Basic have Medicare Part A and B? Okay. For those of you who are in that boat, I don't know whether you know this, but I wanted to tell you, this year they came out with a new benefit, and it is, they will reimburse you up to $600 toward your Medicare Part B premium. Did you know that? Pretty good. I just saved you guys $600. All right? The account, it's an HRA. The account can be used exclusively to pay your Part B premium. That's about all I can say about it, but I can refer you to their website and their phone number. So for this year, you may want to claim that. It's your money. You might as well. Don't know if they're going to continue it in 2019, so pay very close attention to the 2019 benefits in the Blue Cross Blue Shield Basic option. For those of you who have Blue Cross Blue Shield Standard option, it's not offered. It's just the basic option. But I thought I'd throw that in case you guys didn't know, because, you know, it's on page like 134 or something, and I know it's a very interesting bedtime reading, so that's why I threw the slide in. Okay, and finally, are you confused? You're in good company. That's why people return to me. Thank you very much. See, I do it on purpose. No. Medicare Part B, the decision alone is a very personal and complicated one. It is not for me or any of my team to give you advice, but hopefully the information that I've given you here will help you with making that decision if you haven't already made it, or at least understanding how things work in this wonderful environment that is Medicare and the FEHB program. Now, There are several resources that I've highlighted, many that I used. In the back of the room, for those of you who have the Foreign Service Benefit Plan, we have a brochure here that walks you through Medicare and the Foreign Service Benefit Plan and what happens if you don't have Medicare, how the Foreign Service Benefit Plan works. For those of you who have other health plans, whether it's Blue Cross or GEHA, I do know that they have very similar pamphlets. I'd like to claim that we're the only ones that do, but we're not. You may want to go on their website and check out what their brochure says, because I think it's very helpful information. Lays it out in just black and white, plain English, and not the fancy legal stuff. So hopefully that helps. And with that, I think I'm a little over, but not so much. I thank you for your patience, and I'm happy to answer questions. Oh, my. All right, I'm just going to go zigzagging, all right, sir? And could I ask you, I didn't forget, whoever is glaring at me, if you have a question, please go to the mic, because it's being recorded. See, I do follow orders, sort of. For those of you who know me, that sort of is a big sort of. Please, yes, please.
Medicare Part A, but not Medicare Part B, and you have FEHB, is there any reason to consider one of these Medigap policies, from AARP or
Okay, since it's being recorded, I assume I don't have to repeat the question? Dolores?
Are you sure that
Yeah.
I can't tell him up here.
All right, I will, in the meantime, I'll go ahead and repeat that question. So the gentleman just asked me if you have Medicare Part A but do not have Medicare Part B, and you have one of the FEHB plans, is it necessary to get a Medigap policy that everybody is selling? And my answer to you would be no. All right, because you have the same comprehensive benefits with the FEHB plan. All right, and you're going to pay our deductibles and copays, but I'm not sure that you would get your benefit. Okay, question on this side of the room. Yes, ma'am.
Hi.
Two related questions. Have Medicare Part B, have the FEHB plan. Now, some of the FEHB plans, specifically AFSA, require pre-authorization for certain kinds of tests and procedures, but Medicare doesn't. If you have one of those tests or procedures Medicare reimburses, do you need pre-authorization to get the 20% reimbursement? And the related question involves out-of-network doctors. If you go to a doctor who accepts assignment to Medicare, but they're not part of the network that accepts will they still reimburse the 20%?
Okay, so in answer to your first question, the answer is no. In our brochure, in any of the brochures, it states that that if you have Medicare Part B, you can waive pre-certification. Depending on what health plan you have, if you have ours, then you're good. If you have ours, we waive that requirement. All right. Regarding the out-of-network, it really doesn't matter whether your physician is in-network or out-of-network, because what happens is, as long as the physician participates in the Medicare program, that bill will go to Medicare, and then Medicare will send the bill to us, and then we would coordinate benefits. So it really wouldn't matter. Okay? Next question on this side of the room. Sir. Okay, so the question is about the minor dependents. You have FEHB, you retire, you will keep your FEHB. Your minor dependents will be included in your FEHB as in a family plan. You choose to go to Medicare A and B. For your claims, we would coordinate, the health plan would coordinate with Medicare. For their claims, it would be the same normal benefits, because they can't get Medicare for many, many years. All right, next question over here. If you could go to the microphone, please.
Just to connect the dots between a couple of things you said. With Medicare Part B, you said you're living overseas. Probably not a great deal of time. Does living overseas defer penalty for when you return to the United States and then enroll in Medicare Part B?
Okay, the question is about the penalty, the Medicare penalty. So the answer is no. Pretty simply no. If you are overseas and you choose not to take Medicare Part B, and you choose at a later date after age 65 to enroll in Medicare Part B, you will be faced with the penalty. All right, under normal circumstances. I have certain exceptions that I'll be happy to show you. All right? Yes, ma'am. I'm sorry, it's being recorded. All right. Okay, that's an app. You see, this is why the Foreign Service is so smart. For those of you who have questions, please just come up and stand in line. And that will save time. That's an excellent. Oh my goodness, she has a list.
I know, there's two short questions. Do the premiums begin, if you sign up for Medicare Part B, do the premiums begin, you've got that 8-month window, do they begin the month you sign, when do they begin coming out of your paycheck? I mean, is it advantageous to wait till the 8th month?
I would say, well, that's a Medicare question. I have the Medicare booklet. I do believe the premiums will begin the month after you, or within the normal administrative, after you sign up. I don't think they're going to back charge you.
Okay. And I'm not sure how relevant this is, but the difference between a wellness exam and a routine physical.
Okay. You want to know the difference? The difference between a wellness exam and a routine physical. So, a wellness exam is they give you a sheet of questions. You know, what's your newest aches and pains, and do you feel depressed and whatever. And then the doctor, almost like a health risk assessment. Has any of you done a health risk assessment for your health plan? So, and if you didn't, you should, because it's a really good tool. Sorry, I had to throw that in. But then the doctor will go through your answers. They're not going to take they're not going to do x-rays, they're not going to do an EKG. That is an annual physical exam. Okay? So, but the wellness check is just that. They go through your answers to the questions. Well, okay, so I can't speak for Medicare, but I can speak for the Federal Employees Health Benefits Program. She is on your Blue Cross Blue Shield, right? All right, you're still working, correct? You're retired. When did you retire? Okay, do you have Medicare Part B? So she's not, well, okay, she's not eligible for Medicare Part B. Okay, well, we'll find out. So go to my staff. Mickey, if you could raise your hand. Take your name, and I'll do some research, and we'll find out for you. Well, I'm not sure about that. Some of them won't admit it. Good. Trouble. I'll repeat the question.
And going back to changes because they go back 2 years to check on your taxes?
Okay, so the question is about the Medicare Part B premium, and do they go back and check every 2 years on your taxes, and does that change it? All right, so the answer to your question is this. They will go back if you are above those, that $75,000 and $70,000. If you are below that, you're fine. It will be, may not continue to be $134 because they usually increase the Medicare Part B standard premium every year. All right. But if you are above those numbers, then they will indeed go back every single year. Every single year they'll go back 2 years. So while they are looking, now the Medicare premiums have not been announced, probably not even thought of yet, will not be announced till probably November for 2019. They will go back to your 2017 tax statement. And then, and the chart, let me put this chart back up. Okay, the chart here will change. All right? It's not a percentage. It's, I don't know how they do their numbers, but if you, for 2017, if you are above this, say, then your premium would be $267.90 or whatever they deem are the things. Now, what they did last year is they really consolidated these two to make it even harder, to make it even more premium. I don't know what they'll do in 2019. But it's not really based on a percentage. It's really just based on what they say. But they will go back every year, 2 years. So in 2020, they will look at your 2018 tax statement. But if you're below those numbers, then you don't have to worry about it. If you're above it, it just depends on what they decide.
How do you deal with services that the Foreign Service Plan would pay for ordinarily, but Medicare doesn't pay for? For instance, therapeutic massage. Do you have to wait for Medicare to reject this and then file? Do I file independently?
Did you write me that question?
I beg your pardon?
Okay, did you email me that question?
I might have emailed it to you. I didn't get an answer from you yet.
Oh, no, I think you did, but okay.
I did? I don't remember.
All right, so here's the thing. Medicare pays for chiropractic in limited. We don't know. I looked at it. I have the book here. It doesn't say the number. Every chiropractic visit you have to send to Medicare because we have to know if they pay for it or not. Now, for acupuncture and massage therapy, since we pay for massage therapy, we know that Medicare does not pay for that. So you can send those bills directly to us. And I know what you're going to say, because that didn't happen this year with some of the migration challenges. Don't throw anything at me. But we fixed that. So it is working the way it should work. All right? But if it is a chiropractic bill, I don't care whether it is January, July, or December, I don't know what Medicare is going to say about that. So we have to have that statement. Acupuncture, massage therapy, different, just send it directly to us.
Okay, thanks, and I'll check my spam file.
Okay. And if we haven't, we will. It was supposed to be done before I walked in the door.
Is the non-enrollment penalty deferred if you're covered under your spouse's insurance from if your spouse is working and covered from her workplace?
Okay, so the question is if is the late penalty
his or her, I should
okay,
say.
doesn't matter. Okay,
Yeah.
If your spouse, okay, so if you have insurance through your spouse who is an active employee, I don't care whether she's fed or whatever, she's actively employed and you are on her insurance plan, then your deferral is fine. You do not have to make that Medicare Part B decision until she retires, because that will start the change. So if she is age 60 still working, you're age 65, 67, you did not sign up for Medicare Part B, which is fine because you are on her plan. When she retires and that changes, that starts your 8-month special enrollment period as well.
Okay, so it operates the same as if you're working and getting your insurance through your workplace.
Correct.
Okay.
Yes. All right?
Yep, thank you.
And I'll show you, I've got the statements if you need to see them.
Sorry?
I have the brochure if you need to see them, the booklet.
Yeah, that would be helpful.
Okay.
Okay, a variation on that theme. This may be pretty unique, but so I'm the primary on the health plan. Spouse has reached 65. I have not. So she signed up for Medicare at 65 and was scared about the Plan B penalty. So she signed up for that. We're still paying pretty much full FEHB premiums. We're not getting any sort of deduction because the primary person is under the 65, the Medicare coverage. Is that just the way it is? Does she have to take the Plan B because otherwise she'd be paying the penalty forever?
So your wife, well, she shouldn't have had to take Medicare Part B at age 65 anyway because she is dependent on your health plan, correct? She's what, you have Self Plus One?
Yes.
All right, you have Self Plus One, you are actively employed,
No,
right?
retired.
When did you retire?
At age 60.
Okay, you retired at age 60, so she has to take Medicare Part B at age 65 or face that penalty.
Right.
Right.
And there's not, even though if the health plan is still charging us as if we
But
were both under 65.
The health plan is, you're getting the health plan as a retiree now, so your active duty status is gone.
Right.
Yes. So she still has to pay Part B.
Same premium. Yeah, the premium does not change. All right. Thanks.
Thanks for doing this. It's very helpful. So I have a question about foreign service plan premiums. Do you charge the same premium to someone whether who has Medicare Part B and one who doesn't? It would seem the potential liability of the foreign service plan is less for one of those than the other. Do you make any discrimination in that regard?
Well, it would seem that way, but it's not, and it's not the Foreign Service Benefit Plan per se. It is the Federal Employees Health Benefits Program. Let me explain that. Okay, 1959. Don't worry, I won't bore you with the whole 60 years. 1959, Congress enacted the Federal Employees Health Benefits Program. At that time, they had two premiums, right? Self and family, correct? They did not distinguish between active duty and retiree, right? They still do not, do they? It's still one happy family. All right, the only change they made, which took an act of Congress, was that they added Self Plus One 3 years ago. Okay, it's still one happy family. They do not distinguish. So we cannot charge differently for active and retired. But I want to go further. Even if that were allowed, none of the health plans would be able to do that. And here's why. The older we get, the more health conditions we have. And most of these plans, now some of the HMOs are community rated. All of the fee-for-service plans and most of the other HMOs are experience rated. That means that the premiums are based on the experience of the participants. Makes sense, right? A person who is retired over age 65 has Medicare and the Foreign Service Plan or any of the FEHB plans, costs that plan about as much, about $200 more, last I checked, than an active duty person. All right? But there is no savings because, here's why. What you may have done when you were younger is gone to the doctor every 6 months maybe, right? Most people, the older they get, the more doctor's visits they have. That's called utilization, more and more utilization. In addition, we are primary on your medications. Now, the average person costs the plan, over age 65, about $2,300 a year for medications alone. So when you look at the experience of that, the utilization and the medication cost us about as much as it would. So there isn't any break because we're not saving money. Now the person who does not have Medicare costs us about double.
Medicare or Medicare Part B? That's what I'm...
Medicare Part B, but we'll put it all together. So even if we could, actuarially, it wouldn't, the numbers wouldn't work out, and we would have to increase premiums.
It just seems to me that there is a windfall to the association for those people who have Part B and therefore
Right, I know that's what it seems like,
it.
but in reality, the numbers don't work that way. The claims don't work that way.
I'd like to see the numbers. It just
Happy
doesn't
to,
make
I
sense
will be
to me,
happy
but
to
okay,
show
thanks,
you our
I appreciate
experience.
the
Just come by my office.
My question involves the modified adjusted gross income.
Yes.
Many of us have TSPs and IRAs, which at some point we will have to begin cashing out. That will increase our income for that year,
Right.
and presumably that will put us into a higher bracket for that premium. So my question would be, for example, if I were to partially cash out a TSP this year, 2018, that would increase my premium for 2020. But would that be a permanent increase, or would it drop back down again the following year if I don't take out any TSP or IRA?
They go back every single year. So they readjust it every single year.
Okay, thank you.
Thank you very much. My question is somewhat related because there are two natural income increase points. One, when one starts to take Social Security, whether that's at 65 or at 70, that essentially counts as part of income and
A percentage
will
of that will
impact the level at which you're paying the Part B
Part of it is
premium.
taxable, yes.
And also, when you turn 70 and a half, you're obligated to take for savings distributions.
The RMD.
Right.
Yes.
Which, again, could take someone from paying 134. By the time you're finished with those two things, you might be up to 348.30 and not even have been a particularly highly ranking foreign service or civil service officer. So my question is, if you decide to, say, drop for a period of time at, say, 70 or 71, when you're talking about the penalty calculation, is that penalty based on what your premium would have been for each of those years, or just on the 134? Do you follow my question?
I absolutely follow. Unfortunately, I have to stay in my lane, and that's absolutely 100% a Medicare question. I can't answer that. But what I can do is if you want to appeal any of the Medicare decisions as far as your income, there is because they have qualifying life events, and they have and they have things that they will consider. You can do so, and there's a booklet. And actually, I think I have that here.
I appreciate that.
That is Medicare Premiums, and you can talk to Medicare
because
about
these are natural things. They will include Social Security. They will include the minimum random deduction. I just can't figure out what the ding will be if I drop it. But
And
I
that's a
appreciate
Medicare question. I'm sorry, stay in my lane.
Gotcha.
Get in big trouble if I don't.
No,
And I like to be in the right lane.
I'm not. I appreciate that candor.
Hi, this is a question about the Medicare Plus plans. My father, who's a retired Foreign Service officer, still has the Foreign Service Benefit Plan.
Yes.
He had Medicare Part B and another insurance plan from an employer prior to joining the Foreign Service. Their HR department convinced him to drop that plan. He was basically golden, and I'm now trying to help him sort out medical insurance issues and convert it to a Medicare Part C HMO. And now it seems like everything is messed up and he's probably paying way more in premiums than he needs to. Can he drop that C, go back to what he was, or once you get C, are you stuck?
Well, I can't speak for his former employer because
Okay.
that's where the issue is. You'd have to talk to the former employer as far as the Medicare Part C plan. But there is an enrollment. You can drop. So my question: if he has a Medicare Part C plan, why hasn't he suspended his FEHB? Let's talk offline.
Okay.
All right.
All right. Yep.
Hello, just
Hi.
to summarize, I'm the primary on the Foreign Service Health Plan. My husband, I'm not retiring for another 7 years. My husband is going to reach 65, my dependent, next year. He's not planning to retire. He's the primary on TRICARE. Is he eligible to defer that Medicare?
Well, that's a TRICARE question. TRICARE requires that at age 65, if he enrolls in TRICARE for Life, that he enrolls in Part A and B. But that is a TRICARE question.
Okay, thank you.
Stay in my lane. All right, my cards are in the back, as well as some information on the Senior Living Foundation's Planning for Change function, which will be September 27th. And I thank you very much for spending the last hour and a half with me, and I hope I've answered some questions.
Let's thank Ms. Jakub. Thank you very much.